every 34 seconds in the U.S., someone has a myocardial infarction, or what most people know as a heart attack. Occurring when blood flow that brings oxygen to the heart muscle is severely reduced or cut off, heart attacks can happen at any time, often with no warning. What most people don't realize, however, is that women are the fastest growing demographic being diagnosed with coronary artery disease.
This may come as a surprise to many, but cardiovascular disease is the leading cause of death in women. Not breast cancer, not other cancers, but cardiovascular disease is the leading killer of women in the United States. So the treatment of cardiovascular disease and the prevention of cardiovascular disease is really a critical public health issue for women in this country.
Myocardial perfusion imaging, or MPI, is one of the most important tools used today to diagnose coronary artery disease, a major factor in cardiovascular death. In fact, myocardial perfusion scans make up approximately 50% of all nuclear medicine scans performed in the United States annually.
As physicians, we need to look more at coronary flow reserves, look at small vessel disease. If you do the conventional tests, which we do for men, nuclear stress test or regular stress test, you might not find the disease because it won't be in the coronary arteries, which are the normal coronary arteries. It will be in the small vessel disease. The most important thing in women with heart disease is that they don't present the way men present. They have coronary artery disease. Their death rate is almost getting to the same level like men, but they have more small vessel disease, and their symptoms are also not typical symptoms, which are chest pain and shortness of breath. They can come with atypical symptoms and have significant disease. So for women, I think the diagnostic methods are a little different compared to men to diagnose coronary artery disease.
Along with the latest advancement in MPI scanning, educating women on the importance of consulting their physician about coronary artery disease and proper lifestyle choices is one step towards discovering new ways to predict, diagnose, and treat the disease earlier, helping patients live their lives to the fullest.
The American Heart Association has a campaign about heart disease in women. The purpose of that campaign is to bring to the fore the concerns which we have about cardiovascular disease in women. Certainly for women, going to their doctor regularly, getting their blood pressure checked, making sure that they eat healthfully and exercise, being screened for diabetes as well, making sure that their cholesterol is under control, avoiding smoking, and doing all the good things in terms of one's cardiovascular health is really critically important.